vital other than just the lips and and those sorts of things or whatever. So now they're able to do that remotely. And of course, the more it becomes handheld, it's mobile. The other thing you may notice here, of course, is that this is set up so that they can do a lot of their observation, like outside the room, without necessarily having to do that. In ours, there's no real central nurse station in the traditional sense. It's all decentralized. So it's based on the staff being mobile. They're going to need the tools and the technology, the workstations and the like, or whatever's in their hand, or whatever, to be able to do this. And with the wireless connection, whatever, they're able to have all of that information literally at their fingertips and be able to still address it.
So didn't you I think of a nurse with her, iPad, that she's got her handheld computer, because a lot of them do have them, or on her screen, and everything there. She could take and put 3 of her babies right up here, maybe that she's taking care of, or both of them, and she's got visual access to them, as well as the fact of getting some of the other work that she needs to do.
Yeah, it strikes me that it's really important, because a lot of times, even if you're sitting over there, the covers over the baby, so you can't see it this way. The baby still has dimmer light in the room, but you've still got the camera from this side where you have
You can, and also the fact that if you're using covers, most covers, because we do have to do phototherapy on our infants, it could be, that what you would do is just open this and you could have your camera pointed here. So therefore that would give limited access and give a little bit of light so that you would have that.
Sandra, could you talk a little bit about the head wall system? Because what I'd like to just point out is that from a design standpoint, we do want to get out front of these issues. So we've learned a lot just now about, where Bob is in his facility as far as Skyping with the baby. But we want to make provisions so that they don't have to bring in outside and makeshift accommodations, but that we've thought about these things ahead of time and can provide those items.
With the head wall system that we have here, the vertical head walls gives you a little bit more space. It also brings everything together so we're not spread out. It helps you to organize and to hopefully get everything off the floor, which makes it a lot easier for all of us to clean. But the thing is the fact that we have taken the head walls, and if you will notice, the side panels here are blank that are facing the parent side of the room. So consequently, they're not seeing the oxygen outlets, they're not seeing the electrical outlets, they're not seeing all of the cords. They are facing away from the family. But what it does do is the fact that it gives the parents a side, so to speak, and it gives the clinicians a side. Because when you're working over here, you've got your computer, you've got your physiologic monitor, you have got your arm for your pumps, you've got your controls for your incubator, you have the ability to have a task light so that if you're doing procedures and so forth, but you have everything that you can work with here on your side. And you can organize it the way that you would like to organize it. We really would like to have nurses to sort of kind of organize things the same way, but there are preferences and there are situations where we may have to organize, but you do have the ability both with rail and with some pole mounting to be able to successfully organize and have this unique for the infant.